beat and how 6 weeks, doc, that's what it should take to heal. But what was your experience like?
It was very easy. I remember that morning after my C-section, I was sitting down. A few hours I was walking around. You know, it was very, very easy. I can't compare it to the second one. You know, the second one, I was almost bedridden. I couldn't even turn in my bed. I couldn't sit up without support. You know, the two scenarios were very different. And I was like not expecting that. I thought the second one would be as easy as the first one.
All right, now that you brought it up, let's talk about it, okay? We shall engage Doc on the intricacies of it. But what was, you have mentioned it, yeah, your experience with the second one, but what are some of these complications that arose?
I was feeling a lot of pain. Because I remember the day I was discharged, I cried, I wailed. You know, I wasn't sure why the doctor was letting me go with all the pain. I remember the first day after I arrived home with the baby, I didn't breastfeed her. The pain was too much. Yeah. You know, I couldn't sit down, and the most unfair thing, both my nipples were cracked. You know, I was in so much pain. I didn't breastfeed her. I left the baby with my husband to sort her out. Yeah. It was, I can't imagine, the pain was too much. Yeah.
All right, I shall come back to you. Doc, what can go wrong in a CS, which you mentioned, the procedure itself, but in the healing process too?
So complications of caesarean section include infection. First, even before infection, I mentioned bleeding. Bleeding can be very heavy, and that's what you call postpartum hemorrhage. And in the event that it's very heavy, the patient ends up, you know, undergoing certain procedures, having certain medications, and having a prolonged stay, depending on how severe it is. So that prolonged stay, and as a result of that whole process, puts the body under stress. So this predisposes the mother to, you know, infection. Infection on the wound, infection that spreads even to the inside of the organs that surrounds the uterus and all that. And that may also predispose her to undergoing a second surgery to clear the infection, because it forms pus. And yeah, so the pus needs to be cleared, drained, and she's put under medication again. And this may also predispose her to even being admitted into maybe ICU, depending on how severe it is. Yeah, so it can go to such an extreme. Yeah.
Wow, I feel like I want to ask, what should be done to prevent that? Is there anything that can be done?
Yeah, so normally we give antibiotics as per the local guidelines and as what we as COGS recommend. We give antibiotics prophylactically when the procedure is starting, and also throughout her stay in hospital. And we also counsel the mother, even while we're seeing her antenatally, before we admit her for cesarean section. We tell her, look, you're about to undergo a CS. This is the procedure, what it entails, and the possible complications and the possible risks. So by the time she's going to hospital, at least she has like knowledge about it. And we also explain like what to do after the surgery, you know, proper wound care, hygiene issues, take your medication as you're supposed to. Don't stop, complete your dose of antibiotics, you know. Don't stop taking your antibiotics prematurely, because you know, it can predispose to infection. And we give creams and, you know, wound care products to take care of the wound. Yes.
Right. And Minnie, of course, no blame game here, but what Doc is talking about, did you experience it? Did you have, you know, the medics at the hospital you are in explain to you that probably this is what is going to happen, this is what you should do? Because you actually did say that when they were discharging you, felt like, or you asked why they're doing it when you're in so much pain.
So unfortunately they didn't. And unfortunately my CS wound opened after 2 weeks. I had to go back to the hospital for more 3 weeks for treatment. Yeah.
So when all this is happening, what is happening to you emotionally, psychologically? Because I can imagine this is not just physical, it's beyond physical.
I was, I'd say I was very, very broken and frustrated at the same time, because I didn't like imagine this could happen to me. And the worst thing, the CS wound was even smelling. I don't know why. So when I went back to the hospital, they were dressing the wound like daily to see if it closes. And I was very lucky I didn't go back to the theater to be stitched again. Yeah.
Doc, should that really happen?
Well, it's also one of the complications. Infection is another common complication after postpartum hemorrhage. So it may happen.
All right, okay, okay. Let's switch gears now and speak to